totally agree, Frank. And for me, I go back to the confidentiality of the conversation that you have with your doctor. If you know that there's ears, listening on the other side of the wall, are you as open with what you need to share with your doctor as if you know that is completely protected? So sometimes I think, for myself, being in this ecosystem, I'm like, yeah, that's a balancing act, right? Knowing that could get out of the public domain. So there is an expectation that it is confidential, what you say and what you do, and the information that you share with your doctor. Um, and to the point of the regulation being very good for that reason, right? It is intended to build confidence, but the cost of this regulation in our healthcare system, when we're comparing ourselves to other countries, I don't necessarily think is a cost that the average American citizen might take into account. This additional need to ensure that the conversation between you and your doctor is private and confidential. Just my 2 cents.
Well, and that doesn't even account for some of the newer threats on the horizon in a more
Totally.
digitized and the day to day of the reality we live in with everything being in digital systems these days. Nowadays, we have to worry about data integrity just as much as we have to worry about, whether something was, accessible to a threat actor. What did they change? I mean, if you think about the systems where we catalog what prescriptions and, dosages to give to people, if we were to alter those even slightly, it could throw off people's medical treatments. You could change what medical treatments people are there for. And, in today's, larger environments where you get a report and it says this is what that person's in their surgery there to have happen, they go under the knife to go have that surgery happen. And hopefully that doctor knows better than to just read off of a clipboard. But with today's hustle and bustle and everyone's always busy and has so many things in their plate, I can see potential for there being a lot of risk involved in that. Just prescribing the wrong dosages because that's what the screen said or that's what the report printed out. And if all of that's coming from digital system and a threat actor has access to that, there's a very good chance that they could be modifying that stuff and then potentially down the line even be, using that as a leverage point to say, hey, this is why you need to pay our ransom, or, you're going to have people who might die due to the changes that we've made.